At nagbabalik po ang Doctors on TV. Mga kasambahay, ang topic natin this morning, stroke or brain attack. Kasama pa rin natin ang napakahusay at napakagandang doktora from the Stroke Society of the Philippines, Doktora Macrohon-Valdez. Hello, Doktora.
Hello.
Grabe, natutulala tayo sa discussion, no? Kasi parang habang dinidiscuss natin, marami tayong naiisip na pwedeng mangyari. At Doktora, may gaano kataas ang chance na mag-recover yung isang stroke patients? Can they recover completely?
Yeah, depending on their deficits. At saka kung naibigay namin yung clot buster, which is called as thrombolysis. Now, in our institution, if there is a stroke and the patient comes in within the golden period, then we will maximize treatment. First, by giving intravenous na thrombolysis. That is the clot buster that is being given intravenously.
Ang lulusawin niya yung blood clot na nakabara dun sa...
Pampalabnaw siya.
Emergency.
Ng clot. Tatanggalin niya yung clot. And if, for example, we see that within 3 hours or a little bit more than that, like within 6 hours, hindi pa rin nare-reverse, no? Hindi pa rin nare-reverse yung deficit ng pasyente, then we can go ahead and proceed with an interventional type of treatment, which is called as intra-arterial thrombolysis. Pwede rin namin gawin yung mechanical disruption of the clot by using a catheter, parang idudurog yung clot. Of course, this should be done by a neurovascular surgeon. Okay? So another way naman na pwede natin gawin is to do thrombectomy. Parang isusungkit yung clot sa utak. So there are several options that we can do in order to help reverse the stroke, no? Basta for as long as patient comes in within the golden period of 3 hours, then we will see what are the options that we can do in order to reverse the stroke.
So, parang wala pala itong pinagkaiba sa tubero, no? Kung hindi mo siya malusaw doon sa intravenous, lulusawin mo siya mechanically.
At least marami ng advancements ngayon, no? Kasi 10, 15, 20 years ago, wala pa tayong mga ganyan na
yung catheterization, no? Hindi pa...
Pero importante pa rin yung golden period ng 3 hours.
Yung pa rin ang importante.
In the event naman, Doktora, na halimbawa, lumagpas tayo doon sa a 3-hour period, golden period na yon. Ano yung mga posibleng mangyari sa mga pasyente na inatake ng stroke?
So, kung lumampas na po tayo dun sa 3-hour na golden period, what we can only do is support the brain. No? Na support the brain in a way that we will avoid further disability, and also we have to avoid complication from stroke. So that's in a way of what we call as providing physiologic neuroprotection by controlling the blood pressure in a certain target range. Kung diabetic siya, syempre of course, i-control natin yung sugar level and other things that we have to take a look at. And of course, this patient should be admitted in a facility that caters patient with stroke, and they should be taken care by stroke nurses who are well trained in taking care of stroke patients. Like for example, acute stroke unit. So mas maganda po yan pag ang hospital has a facility which is called acute stroke unit, kasi yung unit na yon, people are well trained, no, in taking care of stroke patients. Kapag sobra naman talagang delikado yung status ng stroke patient, then we have to admit that patient in the neurocritical care unit, where there is an neuro-intensivist who will help take care of those stroke patients.
So, dapat good facility.
Good facility po talaga.
Patients kasi Saturday nag-stroke, Monday na ang papacheck up kasi walang clinic ang doktor ko ngayon eh. Sige, hintayin ko yung 2 araw na lang. By the time you get to the clinic, ano nangyari sa'yo? Ba't di ka pumunta sa emergency room? Na-stroke ka nung Sabado, ngayon ka lang magpapacheck up. Pumila pa sa clinic ng matagal.
Yan yung common na problema that we
encounter. Talking about that, paano natin mako-confirm, Doc, na stroke siya versus yung mga tinutubuan ng tumor sa brain? Do they share almost the same manifestation, yung tumor sa brain?
Similar. That is what we call as stroke mimickers. No? Brain tumor is one of the stroke mimickers that we usually encounter. That is why it is important na pagdating pa lang ng pasyente sa ospital, they should be seen by a brain attack team. Kasi this brain attack team, no, the members of this are well trained in order to detect or recognize stroke symptoms and rule out other stroke mimickers. Then if there is really doubt, then we proceed with doing neuroimaging. Neuroimaging like CT scan or MRI of the brain in order to determine evidence of stroke or other possible etiologies.
So, yung brain scan will also confirm kung stroke lang to.
Yeah, that is very essential in the diagnosis.
Kung may blood, yung nag-rupture na blood vessel, or also kung may tumor.
Yes, so
Meron
that is very
tayong phone-in question, Doktora. A stroke is a medical emergency. How do we handle a case at home, halimbawa, while waiting for help po?
Nako, yeah, it is indeed a medical emergency. There is no way that we can handle it at home.
So there's no home remedy for a stroke, no?
Yeah, so what we advise is to bring the patient right away, as soon as possible,
Kailangan talaga
to a hospital who has the facility in taking care of a stroke
So
patient.
dapat yung telephone sa bahay nakasulat doon yung contact numbers ng mga ambulance, yung pinakamalapit na hospital o emergency room. Para kung hindi makalakad ang patient, kailangan siyang sunduin ng ambulance siguro, Doktora. No?
Yes. So.
Sino, Doktora, yung mga high-risk na patients? I'm asking this kasi kung alam mong high risk ka, dapat hindi ka mag-isa sa bahay or anywhere else, no? So, paano natin malalaman no high risk ako? So, dapat lagi akong may kasama.
Yeah, that's a very good question, ma'am. The only way to prevent a stroke kasi is to know your risk factors, first of all. So, by knowing your risk factors, like for example, being hypertensive, okay, that's one of the risk factors. That's actually number one because that will give you about 6-fold increase of having a stroke in the future if you will not control your being hypertensive. Number 2 is being diabetic. Okay, especially uncontrolled diabetes, di po ba, Dr.
Yes,
JM?
definitely. Ganun din, almost mga 6-fold increase din.
Yes, ganun din yung risk of stroke. So the key there is to control your blood pressure and your diabetes. Number 3, of course, other than these common risk factors, will be cigarette smoking.
Alright.
Okay, that will also give you a risk of stroke. Dyslipidemia, yung matataas na cholesterol level in the blood. Obesity. Okay. Obesity, sedentary lifestyle.
Kulang sa exercise.
Kulang sa exercise. Increased alcohol consumption is also a risk factor for stroke.
So lifestyle talaga yung risk factors.
May lifestyle
no? So
din.
talk about poor diet, being overweight and obese, kulang sa exercise, paninigarilyo.
What about age?
Also being age is a
Predisposition, genetic
uncontrollable risk factor.
Yeah, age is what we call as the non-modifiable risk factor. Of course, we cannot control aging. But of course, as we age, you are at risk for having a stroke. And one of the other things that is modifiable risk factor is atrial fibrillation, which is cardiac arrhythmia.
It's an irregular heartbeat.
Irregular heartbeat.
Kailangan magbigay ng mga pampalabnaw ng dugo
Pampalabnaw,
para hindi mag-cause ng strokes. Naku, mahirap pa i-control yung mga risk factors na iba. Diabetes, hypertension,
atrial fib.
high cholesterol.
These are modifiable risk factors, which means to say we can still do something to control it, to change it, so as to prevent one from
That's
having
very important,
a stroke.
because a lot of people have hypertension, a lot of people have diabetes or high cholesterols. Wala silang naramdaman. Kaya ayaw nila uminom ng gamot. Wala man ako naramdaman, okay lang naman ako. Hindi man sumasakit ang bato ko, mali siguro yung kumuha ng blood pressure ko kasi wala akong naramdaman. Gumagaling ang sugat ko sa paa, wala akong diabetes. They're so much in denial, they don't take the medications. They don't know that these things will increase their risk for stroke.
Tsaka very common yung atrial fibrillation, ha?
Ayun, yung irregular heartbeat.
Irregular heartbeat, minsan hindi na rin pinapansin. Dahil mapagkakamalan mo, siguro may nervyos ako, maybe stress ako.
So, thank you, Doctor. Very, very interesting and informative ang information na tunan natin this morning. Before we proceed, pakinggan muna natin ang Naturally Yours.